Welcome back, everyone. This weekend there's an event for runners, walkers, and everyone in between to come together and show support for people fighting and impacted by lung cancer. Saturday is the 2025 Greenville LUNGe Forward 5K Run, Walk, and Celebration. Andrea Oliver with ECU Health, representing the Lung Cancer Initiative, who is also a thoracic surgeon, is here to share more on the event sponsored by ECU Health. So, Andrea, thank you so much for joining us.
My pleasure.
Absolutely. So why would you say this event is so important to Greenville and the lung cancer community?
Well, for several reasons. First of all, lung cancer is the #1 cancer killer, not just in North Carolina, but across the country. Here in North Carolina, about 5,600 individuals passed away in 2024 from lung cancer, and about 9,000 people had new diagnoses during that same time period. Wow. The only real weapon that we have to improve survival is lung cancer screening, and we're only at 17% of high-risk individuals being screened, which is consistent with the national average.
Wow. Are we looking at maybe making that screening age lower?
So the screening age actually had just been changed. So it had previously been 55 with a 20-pack-year smoking history, and having quit at least within the last 15 years, or a current smoker.
Right.
With the recent data that came out in 2021, the U.S. Public Health Task Force lowered that age to 50 so that we could include more individuals, and we found that those individuals were still at high risk for developing lung cancer.
Wow, it's absolutely terrible. So this event, you can see why it is so important to go out and support. What can people expect at the event?
So we can expect a lot of fun things. So it sounds really grave, but what's wonderful about it is that you're going to experience hope. You're going to hear wonderful stories from our survivors, both people currently in treatment and people who are continuing to celebrate cancer-free life, as well as caregivers, people who are bringing their families, people who are providing care from physicians, nurses, nurse navigators. And there's something for everybody. If you're just curious about lung cancer or want to support a friend or family member, you're welcome. Bring your dog, bring your kids, we'll have something for everybody.
That's wonderful. So when and where, the times, the dates, and how can people get involved even if they can't attend in person?
So it's going to be this Saturday, the 13th. Registration starts at 8:30 at Boyd Lee Park, which is in Winterville. It'll go till 11 o'clock. The run walk starts at 9:30. And if you can't participate in person, we actually have online kind of communities where it's called LUNGe Forward, as well as opportunities to donate or get involved with the community here or across the state.
Yeah, and last year you did this as well, the LUNGe Forward, or 2 years ago I think you did it around Halloween time, and people were dressed up in their costumes. That seemed fun as well. So I'm glad to see that you guys brought this back. Well, what's one thing that you hope participants take away from the day?
The most important thing is that we can live with lung cancer. Survivors start from the moment you're diagnosed, so you don't have to wait till you're cancer-free to be considered a survivor. And even if people have passed away, those that are loved ones that are touched by the disease are also survivors. So we want to have people understand that we're all about life, we're all about hope, and we're all about fighting forward together as a community. And Greenville is a wonderful community that fights for each other, and this is a great place for us to come around.
Well said. Dr. Oliver, I think my question for you is, what made you become a thoracic surgeon in the first place? Was there a personal connection to that?
So I actually had done cancer research before I went to medical school. And when I looked around for where I could have the greatest impact as a surgeon, I realized that lung cancer was the one place where surgery was actually our best fighting chance. Amazingly, in my lifetime, things that I worked on before I went to medical school have now become the forefront of cancer therapy. And multimodality therapy has had great, pardon the pun, lunges forward in the last 5 years. So patients that I usually would have said, I'm not sure how much time you have, we've taken a disease that often takes people from us and turned it into a disease that many people can live and thrive with, which is amazing.
Wonderful. Well, Dr. Oliver, thank you. Thank you so much for joining us here today. Well, if you're interested, we'll have all the details on our website, WITN.com. For now, we'll have more ENC at 3 after this.